way back in 1995. I worked at the Moi Teaching and Referral Hospital as an intern, and then posted to West Pokot as a medical officer. What I saw there devastated my thinking about health of women, FGM that was rampant in the area, and the consequences of that. Women suffered from difficult labors, and most of their babies died in the abdomen, and then they had to go through surgery, and then most of them got this condition called Fistula. We had to get doctors from AMREF, or French doctors, to come once a year to operate these women. So finally I decided to go back to Nairobi University and pursue my master's degree in obstetric gynecology in the year 2000. But in between my training, I literally sneaked to Addis Ababa Fistula Hospital, the famous Hamlin's Fistula Hospital, where I trained as a fistula surgeon. And then I went ahead and went to WHO Geneva for a few months to do more work in maternal health and write my first paper on obstetric fistula. Then after my master's in 2004 in Nairobi University, I decided to come home. I came and started fistula work because by then there was no doctor who was doing fistula surgery. At that time then I was thinking, what else can I do to give these women continuous care? That means daily surgeries, because at Moi I was only to operate once a week and the beds were limited. That's when I started Gynocare Women's and Fistula Hospital way back in 2011. Apart from the treatment, which is very difficult sometimes, very complicated operation, I decided to give these women a life after that, beyond fistula. So that's reintegration. So we started to take these girls to school, the young ones. We started to give some vocational training like basket making, some vocational trainings like mat making, things that women can do even if they never went to school. And this is how we managed to handle thousands and thousands of women who have had surgery, whom I can count more than 5,000 to 6,000 now, and a good hundreds and hundreds who are now on a rehabilitation program. And some of them are actually our members of staff in our hospital. We are about 7 girls who are working in the hospital as members of staff during the month of April and May. Despite the fact that we are doing daily procedures, at this particular time we tend to put more emphasis on sensitizing the community, telling the people that this issue of fistula is manageable, because most people feel that it's not treatable, because most of the patients who come here feel they stayed for 20 years or some 20, 50 years leaking urine because they didn't think that this condition is manageable. And since they were very poor, they didn't have the access to information. And then around the 23rd May, we do cleaning around the community during that day as part of the sensitization or mobilization. And then after that, we do surgery. So we increase the number of surgeries during this period of April and May. And then we do really prevention messages, because prevention is like if mama goes to the clinic, she attends a clinic, where antenatal clinic, she goes to the hospital in time during labor, she cannot be assisted through a cesarean section, and she actually escapes getting a fistula. Gynocare has trained more than 50 doctors for the last, since 2011. We have been training doctors on fistula care. But out of those 50, maybe the ones who are practicing, who are passed through the hands of Gynocare, could be maybe 3 out of 50. We have also been training international doctors from Zimbabwe, Somali, who have just left a few days ago, Zimbabwe, Zambia. We are also expecting some doctors from Nigeria and Southern Sudan, and of course doctors from Europe and the US. So I think the message I can give doctors is that fistula is manageable, up to a rate of 85% success, and with training over and over and over again, a doctor can become an expert in fistula care. When you look at the fistula patient and the kind of damage they get, some of the young girls of 18, 20 years old actually get permanent disability. That means they lose their uterus, their womb, they lose their reproductive system, so they cannot have even a relationship, they cannot have another baby. They are actually what we call near miss death. They just missed death by a whisker. And if the government was put in place systems, really what we call practical systems around maternity, safe maternity, evacuating these girls to the hospital in time, even simply allocating enough funds for even from national insurance cover for these women. Some of them do not have ID. So if the national insurance, for example, were to give a hand and support these women and give even reasonable amount to fistula surgery, which is a very difficult operation. Some surgeries take more than 6-7 hours. But you might find that fistula surgery may be allocated 80,000 for a patient who is going to spend 8 hours in theater. She's going to spend 2 months or 3 months in the hospital, and you are going to get a reimbursement of just 70,000 for the entire procedure, which means actually when fistula has been ignored even by the healthcare people. It's not even part, it was even mentioned just 2-3 years ago as part of a package for reimbursement